as you get older, your NAD levels are going to... What is NAD? Hey everybody, it's Gabriel from Elite Mobile IV. In this video, we're talking about NAD. So this is something you've probably seen all over the internet and heard about. That's probably why you're watching this video now, because what is this molecule that supposedly reverses aging? NAD, it stands for nicotinamide adenine dinucleotide. For the rest of the video, we're just going to call it NAD. Now, what NAD is it's a coenzyme found in every single cell in your body. And what it does is it helps your mitochondria produce ATP, which is energy. Now, why is every single clinic telling you you need to start taking NAD? Well, a lot of studies show as you get older, your NAD levels are going to naturally decline, which means you're going to age faster and worse. So if you're suffering from fatigue, if you're suffering from brain fog, if you have anxiety, depression, you can't sleep, it may be because of low NAD levels. So a common question is, do you have to inject NAD? It seems like every single clinic is saying do the IVs or do subcutaneous or IM shots. And there are oral versions of NAD, there are patches. Now, typically when it comes to NAD, you're gonna get much better benefits from the IV therapy. That's because with the IV therapy, you are directly infusing NAD into your bloodstream where it is 100% bioavailable to your body. The problem with the oral NAD is that by the time it gets through your digestive system, it's broken down and you're not really absorbing much or getting much benefits from it. So oral NAD typically is not the best way to go about it. They also have patches and other delivery methods. Those typically don't work too well. There's also the IM and subcutaneous shots. Those, they can have some benefit because you are injecting them into you, but typically the IV therapy is where you're gonna get the most benefits from. Now, there are two precursors to NAD, and what the precursors are is they help produce NAD in your body. It's called NR and NMN. So it's nicotinamide riboside and nicotinamide mononucleotide. Now, these precursors can be great. So these are oral. So if you can't do the IV therapy, if you can't do the injections, then you should look into NR or NMN. They both typically work. Now, the main difference between these versus the IV therapy is that these are going to be pills that you're going to have to take on a regular basis, and it's going to be a much more subtle effect. It's not going to be quite instant like the IV therapy, but it does show that you are going to increase your NAD levels with the precursors. So the benefits of the precursors is that they're more affordable, they are easier to take because you can just buy it at your home and just take the pills. But the cons of it is that if you are super depleted in NAD, if you're really trying to get out of something like chronic fatigue or long COVID, or if you have like awful anxiety or depression or sleep's totally messed up, it may not be enough to really get you over that hump. You may want to consider the IV therapy. So what is NAD used for? NAD, what it does is it's waking up your mitochondria again. It's getting them working. So when your mitochondria is not working, the rest of your body's not working. Your body will work at the limits of your mitochondria. And what NAD is doing is that it's waking your mitochondria back up. It's repairing it, it's fixing it, it's telling it needs to start producing energy again, and it's giving it the ability to do so. A lot of people will do NAD to increase their energy. So if someone has chronic fatigue, NAD is excellent for giving them the energy to do what they need to do in daily life. It's also really good for your sleep. So if you have a disrupted circadian rhythm, if you're staying up late, if you don't feel like you're getting well rested, if you have difficulty falling or staying asleep, NAD has shown to be able to help regulate your sleep cycle so that you're getting better, deeper rest. NAD is also really great for anxiety or depression. If you find yourself, you're anxious, if you have general anxiety, if you're trying to get off of harmful anti-anxiety meds. NAD is also used in higher end addiction clinics. So what it does, it gives people the energy to where they can come off of substances that are harmful for their body so that they don't have to be addicted to them anymore. Typically, a lot of these high end addiction clinics have their own protocols for NAD. They're very specialized in it, but NAD is used for addiction as well. So who should not take NAD? NAD, you have to be careful with it in a few different things. Generally speaking, it's a nutrient that is beneficial for your body, but if you have G6P deficiency, you may not qualify for NAD. There may be a risk of an adverse event if you have G6PD deficiency. It's something you would want to talk to your doctor about if you have that deficiency to make sure that NAD would be okay for you. It's also not typically recommended in cancer. It's something you'd want to talk to your doctor about if you have cancer and you were thinking about NAD, but there's a chance that it could accelerate the cancer or that you wouldn't want to take NAD if you have cancer. So what does NAD IV therapy feel like? I've seen a lot of videos on YouTube where they talk about what NAD is. They really get into the biochemistry of it and how it works. I think for most people, they just want to know how they're going to feel with it. So I have a lot of experience in giving NAD IV infusions, and I've received some myself, so I can tell you exactly how you'll feel with it. But generally speaking, when you're getting the NAD infusion, it's going to feel rough. A lot of people may have a headache, they may feel nauseous, they may throw up, they may have body aches, or especially chest tightness. It could feel like their chest is kind of tightening or have a little bit of chest pain. Now, why is this? Well, the NAD, it's going through your body, it's instantly circulating, and it's just getting everything working again. So it's repairing your mitochondria, and it's just gonna feel like a big workout for all of your cells. And that's why you kind of feel like you're in this crummy state. Typically, what I've noticed is that wherever the most problematic areas are on a client is where they're gonna feel the most. So if we're doing NAD for somebody who is complaining of headaches all the time, it's very likely they're going to have a headache. Or someone is prone to nausea and vomiting, if they're getting an NAD infusion, you can be sure that they're probably going to feel nauseous or vomit while they're getting the infusion. Now, the good news is there's ways to reduce these effects when you're getting the infusion, and that's just by slowing the rate down. So these infusions are going to take longer than a typical IV vitamin infusion. You may be there for an hour and a half to 3 hours, sometimes even longer, just depending how well you tolerate the IV therapy. But after the infusion, all of those weird effects that you feel while you're receiving the infusion are going to instantly go away, and you're going to start immediately feeling better with more energy, more brain clarity, and just overall not feeling as bad as you were when you were getting the NAD. So how can you get started with NAD? So if you want to do NAD IV therapy, Elite Mobile IV, we offer it. One of the benefits with us is that we actually can do it at your home. So you don't have to go somewhere, you don't have to go to a clinic, you don't have to wait in line or schedule appointments. We can order it for you and do NAD IV therapy at your home, so you can relax on the couch or lay in the bed or continue working, whatever it is you need to do. We make it super easy and convenient for you. And we also have really excellent protocols to make sure that you're getting the best benefit that you possibly can from the NAD IV therapy. So I hope you all enjoyed this video. Again, my name is Gabriel Abrams from Elite Mobile IV. And if you have any questions about NAD, leave it in the comments below. I will do my best to answer them. And I look forward to seeing you all in the next video.